All right, today I'm going to go over some common mistakes with walking pattern and with improper glute activation, and also too how a lot of people just will not use their toes when they go and they walk. Okay, so basically what happens a lot of times is you'll see this right here. Okay, someone takes off walking and you see this hip drop just like this. Okay, and they'll just kind of hip drop and then hip drop. A lot of times it's very pronounced in runners. You'll just see them kind of go dunk, 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 dunk like this. And what they're doing there is they're really putting a lot of pressure on the hip. With every step that they just take a boom, 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 just like that. And you can sort of see it in their shoulders and how they kind of go back and forth like this. Whereas you should see more of a gliding motion straight forward with a little bit of sway back and forth. It's not going to be a whole lot with that. Okay, and there are a couple of reasons for that. One, it could be weakness in the hip that is like basically what we'll call closed chain or weight bearing weakness, which can lead to basically structural damage within the hip and the labrum and the joint space itself. But it doesn't necessarily mean that it's going to cause a long-term problem. If you fix the mechanics, you fix how you move, and you fix your strength, and figure out neuromuscularly, or in other words, how the brain connects to your body, how to fix that, you can actually get out of pain without ever having to have a procedure or anything done. The vast majority of the time, people can get better. So the other piece to the puzzle is also foot engagement. That's one of the big ones, okay? So if we have this hip thing going on, oftentimes associated with, I'm gonna back up just a second. So oftentimes associated with that is you have a little bit of hip internal rotation. And we've all seen those runners or the walkers that kind of do this number when they walk, and they're basically, their thighs really touch. And we're not talking about people even necessarily that have really big thighs. But I've literally seen people, and I'll show you real quick what I'm talking about, is they'll be running and their foot will literally turn out like this right here. Okay, that's internal rotation at the hip, and it's not a normal joint mechanic. Okay, the body doesn't normally move in that sort of way, so that right there could be putting pressure on the knee, which could be producing somebody's problem. It just depends on what's going on. A good assessment will tell us that. Okay, so now we're going to go on down. Now that we've discussed the hip and how we can have this sort of what we call Trendelenburg type thing, we've talked about internal rotation at the hip. Now let's talk down at the foot, because the foot can be a culprit as well, which the foot, heel strike in through mid stance, and even at terminal stance can cause problems up the chain in the knee, can cause internal rotation at the hip, can even cause a little bit of that Trendelenburg position that we talked about as well. So with the foot, when we hit, oftentimes what happens is we're going to go through a bit of pronation. Some pronation is normal. Some pronation is healthy. Okay, it's when you have that person that pronates so hard that everything falls in. Okay, and a lot of times what's going on there, you'll notice a couple things. Not necessarily even foot flat, but basically if you look at the tone of the musculature in their feet, there's not really much there. There's not very much strength in the foot. So it doesn't give it very much support, because what we know and what research has actually shown us is that the primary stabilizers of the foot aren't really necessarily the structural pieces like the plantar fascia and the ligaments and that stuff. What can give you the most support is actually engagement of the extrinsic muscles. In other words, the muscles that are up in your leg. Those are the ones that can give you the absolute most support and get you into a good neutral position on your foot. So when you're taking a step and everything, you're going to have a small bit of pronation, but if the foot is just relaxed and doing what I call just lift off, so basically when you take a step, we're going here, here, and they're basically, watch this foot, they basically just kind of go like this and swing through like that. If they're just kind of doing this sort of lift off thing like this versus a push off where basically you go heel, mid stride or mid stance, grip the toe and then pull through nice and easy and make a nice smooth pulling motion, then odds are you're probably in a bit of hyperpronation and you're not using your foot muscles good enough to give you the stability that you need to let you go through a normal, nice and easy stride without pounding the pavement as much, okay? That will help you kind of ease in and soften the blow if you strike more of this heel toe and pulling through nice and smooth kind of motion. And what that takes, it actually takes a bit of awareness as well in the hamstrings and the glute, because when you take that step, you're here and you're pulling through, you're actually firing the hamstrings and the glute to help do that sort of motion. And I'll show you from the side here what that looks like. It's basically you heel toe, and I'm going to bring the other foot forward, so you just heel toe, here's the mid stance, and we kind of do this number here, pushing through, and then lift and come through, okay? What a lot of people actually do is they'll go heel strike, midfoot, and then they get to in basically like terminal stance, this position here, and they're just gonna go whoop, like that right there, okay? They just kind of go here, and then they just lift up and then pull through. Oftentimes, those are also the people that are complaining with a lot of shin splints also, because they're not using the appropriate muscles in their foot. So what you have to do is heel strike, come through, use those extrinsic muscles of the foot to give you that nice and easy push through, and you've got that basically sort of like a leg kick kind of thing that comes through that gives you a really smooth motion, and it should help to smoothen the stride out. So those are some really big things that you can look at as far as performance with gait mechanics. The other thing is checking your foot inversion, eversion, plantar flexion, and dorsiflexion motion. So all the three motions, so inversion being this motion here, checking eversion, checking plantar flexion, checking dorsiflexion. Are you good and strong on all of those? And if you're weak, where are you weak? How are you weak? Are you able to hold your foot with a single leg balance? That's a really big one for runners as far as foot strength. And I'll show you real quick. I'll kick my shoe off. But if we get in this single leg balance here, and if we watch the foot, it's kind of hard to see, but if our foot just falls in real heavy like this, we get in a single leg balance and it just kind of falls in like that, and we can't correct, we're gonna probably fall this way. And guess what's going to happen? We're going to internally rotate the femur, we're going to let the tibia drop in, and you're going to have problems. Whereas if we engage the foot, hold there, and then just kind of come up like so, and hold in a neutral position, all the while we're holding our hip. And if you can hold that, that's a pretty doggone good thing. If you can hold that for 30 seconds, that's pretty doggone good. If you can't, that's a problem. And you need to work on your extrinsic muscle strength as well as your balance, because that's going to become a problem for you long term, and it's going to produce knee pain, hip pain, all other sorts of problems that you need to get rid of. So anyway, I hope you found this video helpful. If you have any questions for it, you can feel free to reach out to me. My name is Dr. Dustin Howard. I'm a concierge physical therapist, and I'm a personal trainer here in Nashville, Tennessee. I've got a training studio that I work out of down in Franklin. I also have a studio up in West End that I just picked up. I'm finalizing some things there so that I can start seeing clients up there. But I also do concierge mobile sessions for busy people. Those tend to be more like the business executives, the people that don't really have time after work to go do things. So they schedule something real quick during the middle of the day. We come in, we check things out for an hour, and then go about their day. So that's me, that's what I do, and I hope you found this video helpful. If you found it helpful, I want you to just kind of share it to some folks. Send it to people. Obviously, this disclaimer here, by viewing this video, I would hope that you would use the information in it, but by no means am I guaranteeing you that any of the information in here is your exact problem. If you have knee pain or ankle pain or any issues in the hip, my best recommendation is to get checked by a medical professional, and one that can actually look at you and observe you functionally with movement. And actually offer free screenings to people around the Nashville area that want them. Just feel free to reach out to me if you want to. Dustin at drdustinhoward.com. You can shoot me an email there. That's perfectly fine. Any other questions, feel free to reach out. I hope you have a great day.